Hello, everyone. Hello, hello. Good to see everyone. Thank you for joining. Today, we're doing a Friday forum of the TBPPM Learning Network. Really happy to see everyone popping in. We are live streaming this also on YouTube for those of you who are joining from a different side. So, as everyone knows, next week is going to be a big meeting, a big week for the tuberculosis community and for the overall health community. The UN General Assembly will be meeting in New York and discussing universal health coverage, pandemic preparedness and response, and tuberculosis. This is the first time they're discussing tuberculosis since 2018, and we will be reporting back on the progress made. And 2018, of course, after that, we had a pandemic, so there is progress, but there's also a lot of hiccups that we need to be talking about. So it is a real opportune time to make noise about tuberculosis and to have heads of state come together and push for political commitments. What we're doing right today is we have a fantastic panel of speakers, and I'm really grateful for all of you to make time to join us. We are talking specifically about what the political declaration really means for country level action and programming, and how can we make sure that any of the political discussions that have been going on and the promises that will be on paper next week, we would like to hear what it means from a country perspective. And to set the scene, to have this discussion properly, I'm really pleased that Monica Diaz from WHO, who is our key person within WHO as the lead program on any multi-sectoral and accountability initiative. She also leads the NTB flagship initiative, that's the Director General's initiative, and she handles really honestly all these important multi-sectoral discussions around TB. So Monica, I know your plate must be super full with the preparations for next week, and very, very pleased that you will be introducing and setting a few words. After that, we will be going to Robin Wade, who is from the civil society point of view. She's working for the GFAN, the Global Fund Advocacy Network. She's leading the TB Hub, the civil society hub that is connecting all NGOs, civil societies, and advocates around the UNHLM in New York next week. She'll be giving a short, crisp overview of what's happening, because there's way too much that's happening next week. So again, thank you so much for taking the time to bringing our network up to speed. And then we'll move to a panel discussion for 45 minutes where we actually hear from people that have been working in tuberculosis programs from different perspectives. And I'm delighted that Emily Hedrick from the FHI 360 will be moderating. She's a TB nurse. She's a nurse, not a TB nurse. A nurse has a background. She's working on COVID and many other issues within FHI 360, and brings really a practitioner's perspective to the whole overall discussion of health and health systems. And I think she's a wonderful person to lead us into what can we actually take out of all these political declarations in a practical way. And so our panelists are Aditya Wicaksono. He's the PPM lead and the advisor to the National TB program in Indonesia. Then we have also Stella Makpu, who is in Nigeria and joining us from Nigeria and is working with the National TB program there, and again, working as a public-private sector lead. We also have we have Tina Campbell, who is a TB nurse in Saskatchewan in Canada and the co-chair of the Stop TB Canada network. She'll be bringing in her perspectives from Canada, who's working very much also on elimination of TB. And then we have Joanna Soares-Lin, Juliana, sorry, I'm not pronouncing your name correctly, who is the Director of Infectious Diseases in FHI 360. And she'll be talking to us from various points of view from infectious diseases and health systems resilience, and bringing us up to speed on what's happening there. And if our other panelists will join, then I will introduce them at the time. But for now, I would like to hand over the floor to Monica to please introduce us to and tell us a bit why this political declaration on TB is so important in this time.
Thanks so much for that introduction, Petra. And warm greetings to everyone. We're really excited. We have 1 week to go to the second UN high-level meeting on tuberculosis. This is a great opportunity. For the second time, heads of state will convene on ending TB, which for us is honestly a very big win. I've worked in TB now over 15 years, and we've seen varying levels of commitment. And based on what happened with the first UN high-level meeting, which happened in 2018, you could see that there was so much energy that was built, because when you have commitment at the level of head of state, then you can, given that TB is not just a medical disease, you need action across, the drivers of the epidemic, across poverty, across labor, justice. There are so many of these elements, so many vulnerabilities. It's been really important that we have that we have all sectors engaged, and it's beyond the mandate of just the Ministry of Health. And for this to work out, you need that highest level leadership, because the Ministry of Health cannot tell other ministries how to engage or what to work. And this is why the UN high-level meeting is so important. And it also helps that we have, I want to share very quickly a few slides. I told Petra that I won't, but then I decided maybe it's easier that way. But just to kind of underline that, that there are so many of these priorities, the targets that are developed, especially that come out over a 5-year period, stay on the political landscape that that politicians have, and there is a lot of action that moves forward. We've seen this in India with Prime Minister Modi and others. Petra, can you see the slides? Just double checking.
Yes, Monica, we can see the slide.
Okay, great. So I just want to say that when you look at the high-level meeting that will happen on Friday next week, there's been, a handover of leadership. There's going to be a new president of the General Assembly who will lead it, His Excellency Dennis Francis. What is pending right now is the outcome document, which is the political declaration, which is super important because it has all of these targets within, concrete targets. In fact, we had a press conference recently, just yesterday, and one of the journalists was asking about this. We have one of the stronger political declarations because there are targets within, because there are these commitments to reach people with care. So let me quickly show you that there's been a lot of progress from 2018 to 2023. And this year is special because there are going to be 3 high-level meetings on TB, one on universal health coverage, and the other on pandemic preparedness. This is really key. So I want to touch base on these because there's been a lot of preparation. Sorry, there's a lot of preparation that's gone in. We've been briefing missions. I know that at the community and civil society level, Robin, who will go next, will also share about what's been done at the civil society level. But WHO at the level of countries, at the level of governments, partners, we've been regularly briefing, on what the key priorities are, what the work is, and on the latest updates. We also have a civil society task force that's been quite engaged with our Director General on HLM preparations. And of course, what's been really important for the high-level meeting is the multi-stakeholder hearing that was held on the 8th of May. Tina, who we can see here, was an excellent speaker at this event, very powerful speaker. And of course, we had Juliana, who took the floor and spoke about private sector engagement. So that was really positive. I want to flag that the political declaration was developed through intergovernmental negotiations among missions in New York, developed with countries. And a lot of, what is in the declaration is built around what we've shared, basically the DG flagship initiative with various priorities, but mainly what I'd like to flag here are the targets that are there. And we see these targets in the outcome document that's right now still in the process of consensus. And these are the targets that I was mentioning, the 40 million, 30 million target between 2018 and 2022 was really, a key driver of action in countries. Likewise, here we have for the next 5-year period, we're looking at reaching 90% of 45 million people with treatment. We want to make sure that everybody who's diagnosed with TB were diagnosed with WHO rapid test, recommended rapid test. 90% of people, again, another 45 million people reached with TB preventive treatment, ensuring 100% financial risk protection, pushing the agenda forward for new vaccines and, pushing on closing funding gaps. And also to inform this is the UN Secretary General progress report that was released by the UN Secretary General, which really chronicled, and we can share with you, which really chronicled what the progress has been between 2018 and 2022. This is really important, has been important to look at the update of this declaration, which will then set the agenda for the way forward. And also on the sidelines, just to say what we will have next week is also this push on research and innovation. We will be launching our TB Vaccine Accelerator Council. They'll be meeting together for the first time. So all important elements that have built towards this political declaration. If we want to move the agenda forward over the next 5 years, basically you're talking ending TB 2030. But if we want to get there, given the impact of COVID-19, given the impact of conflict, war, and other issues, we need this strong push, acceleration over the next 5 years. And this declaration is the tool through which we can do it. And that's why it's so important. And I know that colleagues, communities, partners, all of us are working, pushing and trying to encourage governments to adopt this declaration. And we're really hoping that this is something that is a strong outcome of the high-level meeting. So thank you very much. I'll stop there. Thank you for inviting me, Petra.
Monica, this was fantastic, and your slides are always super helpful. We would love to share them with our community too, so that they can go over it, because there's so much wealth of information. So we will be posting the slides and the background materials. I've put a link in the progress report that Monica referred to in the chat, but we'll be also posting this on the report from our outcome of the meeting. Monica, thank you. Thank you. We know you need to drop off. We really appreciate you being here, and I am glad to kind of hand over to Robin, because both of you are a nice kind of tandem of information. And Robin, please take the floor from me and enlighten us what's happening in New York next week from a civil society point of view. And everyone who's listening in, I know we're kind of in a tight time frame, because I really want the discussion panel. So keep in mind that we probably will be running over 10 to 15 minutes, if that's okay. But Robin, if you can keep it short, then we have time for the country discussion. Thanks.
I will
Thanks,
keep
Monica.
it short.
See you.
Hi, everyone. It's nice to see you. So my name's Robin. I am the policy and advocacy lead with the 2023 TB HLM Affected Communities and Civil Society Coordination Hub. Our mandate is solely to support, mobilize, and equip advocates around the world to engage effectively in the high-level meeting process. So we've been working hard all year, and hopefully the fruits of our labor will be seen next week in New York. But really, the opportunity this year, with there being a high-level meeting for TB, is threefold from an advocate's perspective. The TB HLM provides the opportunity to influence the outcome document that Monica was talking about, which is important because we want an accurate representation for the public record of the state of the TB crisis right now. It's also important because it will ideally be a strong political declaration with key targets that we can all use to hold our governments accountable to post HLM. There's also an opportunity for us all to influence how our countries and governments show up to the HLM. So it's not just about what's in the political declaration, but it's how, say, Canada comes to the floor and uses its 3-minute speaking time. We want to see countries show up and make some sort of strong commitment to action. So we want them to come to the table with something substantive. And lastly, it's important because there's so much happening around the high-level meeting that it provides an opportunity for advocates at national levels to knock on the door of policymakers and say, hey, there's an HLM happening soon. Did you know that? Let me brief you about it. Let me tell you what we want to see our country doing in the fight against tuberculosis. So with that said, I'm just going to share my screen and tell you where we're at right now throughout the in the HLM advocacy engaging process. So I'm getting my screens up. Can you see these? You can see them? Okay, great.
Yes, Robin, if you could put it in presentation mode.
Do I do that? I click this.
Yeah.
Ah, got it. There we go. Okay, so where are we? Okay, so next week's the high-level meeting, and we want to see a political declaration on the floor there. We've got one version that was launched by the President of the General Assembly on September 1st that we're hoping becomes the final political declaration, but there's a bit of a risk that it doesn't, because we know that the G77 broke silence on the version before that. So there is some discontent still with the language of the political declaration version circulating now. We have come a really long way, though, since the first zero draft that we were calling a below zero draft was launched in May. So all of the advocacy we've done has really made gains in the text of that declaration since May. And we now have some wins that we can celebrate. So we now have specific measurable time-bound targets. We now have some key commitments to social protection for people with TB. And we, for the first time, see an explicit recognition of human rights related to TB R&D. However, there are some misses. We don't see any substantive key asks related to national TB responses being equitable, inclusive, gender sensitive, or right-based. While there's lots of nice language to that effect, there's no substantive specific targets. And we also don't have any explicit commitments to ensure public funding for R&D comes with access conditionalities. So overall, we think this version of the political declaration is okay. It's not amazing, but it's something we can work with. And we're hoping to see it pass at the opening session at the HLM. But what we need everyone to do right now is get ready with their statements so that we can all react as a community to what is published in the political declaration. So if you're doing anything right now, do that. The other thing you can be doing right now as an advocate is working with your country around how they're going to show up at the HLM. So you can be talking to your missions in New York. You can be talking to the Ministry of Health in your country, asking them that they make a statement for the record, they make an ask of the wider community, and they make a commitment to action when they use that 3 minutes of speaking time. So in New York, the hub is organizing a ton of different events. I've got 3 of them up on screen right here. Really what we want to do is we want to bring the community together, rally momentum and energy, network, and have a really strong, loud voice while we are in the room of the HLM, but also while we're in New York. So we'll be engaging with media. We've got a stunt planned in Times Square, etc. So if you're going to be in New York, do register to attend all of our events. And we've got a toolkit coming soon for advocates so that you're equipped to leverage all the different side meetings that are happening to talk to important decision makers about TB. If you're not going to be in NYC, there is still a ton that you can do virtually from home. The HLM will be live streamed on UN TV. So there's a link right there that I'll share in a moment. And I think / hope that Stop TB is going to stream it through their Facebook channel like they did with the multi-stakeholder hearing. But you can also take to social media, you can have your statements ready, you can engage with your local media, and you can, of course, post HLM, be ready to hit the ground running to hold your government accountable to whatever commitments come through in that outcome document. So that's all from me. Really looking forward to New York. Oh, we've got a social media toolkit that will be circulating. It is already live now that you can use this week and throughout the HLM itself. We also have a commitment to share with everyone photos from our Times Square and community picnic event on the eve of the HLM. So that will come out Wednesday next week with an embargoed version of the hub statement. So you can use that embargoed version however you like the following day, adapt it, or use as is. And that's all from us right now.
Fantastic. So everyone, you've heard it. Next week is going to be a big moment for noise for TB, and for sure as Learning Network we will be with you, Robin, and we will be posting all your information. We will be also during the UNHLM live tweeting, so anyone who wants to kind of pick up on information and see what's happening from the PPM perspective, we will make sure that we will be looking out for you. So thank you, Robin. Thank you again for being here with us and for giving us all those wonderful resources. And I'm now excited to actually move to the conversation where we talk about what is actually the impact of all of this at country level, and how does this matter, and how can we make sure that these are not empty promises by the end of next week. And for that, I am very pleased that I can hand the floor over to Emily to moderate us through the discussion. Emily, I think Tadel in Ethiopia is having connection issues, as is Stella. So when they pop in, just look out for them and maybe call on them directly. With full appreciation that we need to lean on you, Aditya, for on-the-ground perspectives, and Tina for you for on-the-ground perspectives as well. And of course, Juliana, you have seen, and you're actually joining from Bangkok, so you'll also be able to give us some of those voices. But we're missing Ethiopia and Nigeria. Hopefully they'll join. Anyway, Emily, the floor is yours.
Thank you, Petra, and thanks so much for having me. I think this is such a fantastic opportunity. You know, I'm really just here to ask questions. And I think when we get to share perspectives in this kind of forum, we all get excited in a different way over different things. One thing that I'm excited about, you know, you mentioned this is the first time since 2018 that TB has really been on these high-level meeting agendas being discussed in this space. And then we had a pandemic. And I wanted to reflect that it was a pandemic, it was a respiratory illness pandemic that infected and affected vulnerable populations extremely disproportionately. And yet at the same time, we saw with the COVID pandemic, it proved the concept that if there's the political will, there can be extremely rapid and effective action to save lives. And if we could do it with COVID, we could do it with TB. And so I think injecting that proof of concept into the energy that we're bringing to the meetings next week is going to be really important. So like I said, I'm just here really to ask questions. And so I'm going to start with, it's a two-parter. We're going to start with the positive and then follow up with some concerns. So I'd like for our speakers to think about, I want to know what you're feeling most excited about for the UN high-level meetings and the declaration on TB next week. What are you feeling most excited about, but also what you're most concerned about? And what do you think is not going to be addressed, or what are you afraid or a little concerned might be missed and that we should be aware of? And so I'm going to hand it over first to a fellow nurse. Tina Campbell, we'd love to hear from you first. What are your thoughts?
So just to be clear before I start, you want me to answer both parts of those questions? Is that question?
Yep, we'll do a two-parter. What are you feeling most excited about, and also what you're most concerned about?
All right, perfect. Good morning, everybody, or afternoon, wherever you're joining in from. My name is Tina Campbell. It's pretty early here, 7 a.m. here in Saskatchewan. I think I am most excited for there to even be a discussion on TB. I've been working in TB for 13 years, and when I first started, you barely heard anybody talk about it. So I'm really, really happy that it's being discussed on an international level. Also as a follow-up from the first high-level meeting on TB regarding its previous world commitments from 2018. So 2018 was 5 years ago, and Canada specifically committed to the goal to eliminate TB by 2030. So that is 8 years away, and those targets are seeming less and less attainable now due to a number of factors, and COVID-19 pandemic, for example, has affected all aspects of TB care, research and development, and even advocacy. So the world was focused on the pandemic, and because TB was left out as a priority in many situations, I'm really relieved that we are trying to shift the attention to other infectious diseases, and TB being one of them. So when I was in New York in May and had an opportunity to speak as one of the panel members, one of my asks were, to leave no one behind, and all national TB responses to be equitable, inclusive, gender sensitive, rights-based, and people-centered by committing to cost of community rights and gender action plans. So as Robin mentioned, there was really no direct commitment or recognition of that. My concerns are, TB programming cannot be sufficient if we're not hearing from those who have lived, breathed, or had historical experiences with TB and TB care. Having these voices take part in planning and implementing programs and policies are critical, especially in my region where I specifically serve Indigenous communities that are heavily impacted and still living with intergenerational trauma and grief from attempts of colonization. So TB continues to come with negative feelings and views, and we have to take into consideration and make the effort to learn how to approach TB care in different communities. So I've learned that each group of people and their needs are unique with each community. We have to be mindful of this if we want to successfully and compassionately provide TB services. There also continue to be a commitment to focus on eliminating TB-related stigma, and we can do this by involving various groups, families, and work together on ways we could address TB-related stigma.
Fantastic. I think you summed up a lot in and the word that really I heard was relief and hope, but some concern as well, all very valid points. I'll move the next person to answer. Let's go to Aditya in Indonesia. What are you feeling most excited about for this declaration, and what are you most concerned about?
Okay, hello everyone. First of all, thank you for having me, and thank you, Emily, for moderating this station. I'm Aditya, PPM advisor for Indonesia National TB Program. Well, what I thought about the UNHLM Declaration on TB, the most exciting part is, well, as we know that since the last UNHLM on TB in 2018, there has been so many updates for TB control efforts in Indonesia. And in the mid-year of 2021, Indonesia released the presidential decree on TB, which mandates all sectors in governments of Indonesia, including private sectors and also community, to come together hand in hand in effort to end TB. And this UNHLM declaration on TB is I think is a perfect opportunity to, advocate for the non-health sectors at the national and subnational level to come hand in hand in combating TB, and in line with the our presidential decree on TB. And also, we are excited that the UNHLM Declaration on TB now address the importance of investment in TB vaccines, diagnostics, and health technologies in high burden and developing countries. So we support the knowledge sharing and also the technology sharing and also the practice sharing from other countries to the high TB countries, including Indonesia. And we're thrilled to have more discussion on the development of the short-term TB treatment regimen, and also its accessible and high-end diagnostic tools, and the invention of the new vaccine of the prevention of all forms of TB. So that's all the thing that I think most excited about this UNHLM declaration. And for the one that I concern about, actually from my side, there is no particular thing that I concern about because I think most of it has been covered in the declaration. For instance, that we acknowledge that the TB is not only a health problem, however, it also has an impact on the catastrophic cause of TB. And also, we would like to highlight the need of the sustainable financing for the TB in order to ensure the access to quality prevention and diagnosis, treatment, and care of tuberculosis. I think that's all from my end, Emily. Thank you.
Fantastic. No, it's great to hear that you're more excited than concerned. That's a really good attitude to have, I think, and you really bring up, I think, a great point that you know, the science can get there on prevention and diagnosis and treatment in ways that are accessible to the communities that need them. The science can get there, but can the funding support it? So great points. I'm going to see if Stella has been able to join or if the connection has improved. Stella, are you with us?
Yes, I am.
Hi.
Yes, I am.
I'd love to hear from you. Take some time and let us know what you're most excited about for the TB declaration and also what you're feeling most concerned about.
Yeah, thank you very much. I must appreciate the TB Learning Network for giving us this opportunity. Well, coming to what I am most excited about in the UN Declaration on TB, in fact, the declaration is all-encompassing and almost all vital areas on TB are covered. And strategies to control the scourge of TB is already in place. Just a little more push on political commitment at the country level is what is needed. Then to my concern, I must confess I have a unique concern. I know almost the declaration is really very, very, very clear, but it's like the declaration was silent on both drug susceptible and drug resistant TB patients that refuse treatment. We need to protect the public. The number of people involved in this may not be significant, but if left unattended, it might have a ripple effect in the control of TB. So that's my concern. Over. Thank you.
Wonderful, Stella. That is an excellent point. Thank you for highlighting it. I think the solutions or the options for addressing that concern are, certainly something to discuss, but thanks for bringing it up. I think that's a really unique perspective, and I'm so glad your video has been able to come on. Please continue to join us. So finally, I'm going to hand it over to Juliana Suarez-Lin from FHI 360. What are you most excited about? I'm going to reframe it for you, Juliana. Not only the UNHLM declaration on TB, but also the concurrent meetings on UHC and PPPR. What are you most excited about for all three happening around the same time, and also what you're concerned about?
Oh, thanks, Emily, and hello, everyone. As Monica said, I think it's wonderful to actually have a meeting and to have a declaration and to have a lot of significant gains and wins, as Robin pointed out. One thing that I am, and I'm going to start talking about TB first, that I'm particularly very excited about to see in the declaration was at least the sentence to commit meaningful participation and inclusion of people and persons with disabilities. And I'm very glad this was there, because I'm very involved, in trying to break the cycle of invisibility that is around persons with disabilities. And this being in the declaration is a significant gain. However, how this will be translated into action, practice targets, I think that's what for me is still unclear. But seeing that there, really gave me hope that we can come up together to address, I think, a significant gap in quality of care and services and inclusion, and including comprehensive rehabilitation and social support services for TB survivors with disabilities. So I thought this was a significant gain. And for me, it touches personally in an area that I'm, very involved in. The other significant gain, I think, in the TB declaration was basically there is a commitment to ensure that all people with TB have access to health and social benefit packages. And I think this commitment to try to strengthen financial and social protection beyond, the health sector is really important and critical. As we know, a lot of people with TB and families, they undergo very difficult circumstances, and they have catastrophic costs related to TB treatment, and we don't want that. So having that in the declaration and tied to potential funding, that is a win. The other thing, and now talking a little bit about how this intersects with the other declarations, I think there was an acknowledgement in the declaration of resilient public health systems and a strong public health systems as an essential pillar of the tuberculosis response. And this really ties very nicely with the universal health coverage agenda. And they even mention, which I think, Emily, for you and for all of us, there are either healthcare workers or community health workers acknowledging that women, we are really 70% of the global health workforce and 90% of the frontline health workforce. However, we are not involved in leadership positions. Seeing that in writing, for me, it's significant. What I think, it's a miss is really how we can do better and how we can, really set bold targets and accountability frameworks to make sure that we are changing, the status quo. Because I would like, at least for the next 5, 10, 15 years that we are really changing the mark here. But it's wonderful to see that. I think you're asking about a big miss, and when we think about integrating these 3 agendas, the UHC, the PPPR, and TB, I wish TB had been included as a tracer indicator in the global and national UHC, PPPR, AMR strategies, because we know that TB is, a strong indicator of how primary healthcare systems are doing, and at least in the last version I saw, this was not included, and for me, this is a big missed opportunity. And as Tina said, I think the lack of commitments to community rights and gender costed action plans was also a big miss. I'll talk in the next session. I hope, I could keep talking because I have one more thing to say about how we can maybe help change this, but I'll hold my thought and hand it over to you.
I will remind you of that as we wrap up. But no, we do want to move on from kind of what we're thinking to what we're going to do. And so our next question to our speakers, and we'll sort of go in the reverse order, I think, is, particularly those of you based all over the world, working directly with country level stakeholders and communities, is how do you plan to use the new declaration at your country level or community level to advance TB programs for those affected and infected with tuberculosis? And what stakeholders are you going to involve? Public sector, private sector, the traditional set of stakeholders, or seeking some more innovative partnerships? And so we'll go to Aditya to answer that first.
Well, thank you, Emily. So in response to your question, I think along with the leadership from our president through the presidential decree on TB, we will ensure that all the ministries and stakeholders related to TB will take action to the NTB program itself. So for the past years, NTB Indonesia has taken some collaboration efforts with some of the health sectors and also for the non-health sectors, such as the big chain hospital management, industry and big companies, philanthropies, and also community organizations, TB survivors, and also the professional organizations such as the medical doctor or the nurse association within the country itself. And for the upcoming years, we also want to, engage more stakeholders, including to integrate the TB control in the workplace itself. So for this declaration, we can also make this declaration become a tool for our advocacy for the private providers to provide the standardized TB care within their facility. And also, it also applies to the other private sectors with the central management that they will try to look at the potential collaboration with the national TB program in each sector, whether it is in industries or corporation, so they can provide the TB control program within their sectors itself. So that's from me, Emily.
Fascinating. No, it sounds like you've got a lot of voices there, and I particularly appreciate the involvement of professional associations of health workers who know not only the clinical experience of the sick patients they're caring for, but they also know the really complex and really important experiences of the communities they're working in. And so thanks for that. We'll go next to Stella. Stella, are you with us? How are you going to use the new declaration where you work in Nigeria and West Africa to advance TB programs, and what stakeholders are you planning to engage with?
Thank you very much. So as we are expanding to the TB services to new sites to be able to reach the unreached and strengthen old sites by constant supervisory visits and mentorship. And this mentorship could be through Zoom calls and other electronic platforms. And now, for us to be able to get the government committed in the fight against TB, we must always, that's advocacy, an innovative advocacy to the leaders, so that they will be able to provide their own counterpart funding. The government, they are trying, sometimes they will help in the drugs, but the activities that will generate the patients also need to be funded. Now, to the organizations, we have multi-national organizations. These people, they should be able to provide, to the society where they make their profits. I know in Nigeria, we have this Abami partner. At one point in time, they were able to build very standard health facilities in the 36+1 states. So we are all out to engage these multinational companies to help improve fights against TB. Then for the communities, they must be engaged, and the community gatekeepers must be, involved every step of the way, because they are the ones that know the terrain, in their states. Thank you very much. Yeah.
No, thank you. An excellent point about mentorship. I think that's one of the most important part in this whole work of advocacy and patient advocacy and health advocacy is mentoring those. We have to show excitement and passion and a way forward to our next generation leaders, right? So excellent point there. Tina, over to you. How are you going to use the new declaration with the communities you work with? And how are you approaching innovative stakeholder engagement there?
So I would keep reiterating Canada's commitment to ending TB by 2030. And in order to do this, we have to see drastic changes in our TB care delivery, such as adequate funding and resources for programming, especially when responding to outbreaks of tuberculosis. So when there is a TB outbreak identified, our organization and our program continue to learn right now by trial and error with each coordination response. We have a very small team in my region. We only have 2 full-time TB nurses, and we have a few contracted, responding to many outbreaks and many requests to support our communities. We have 33 in total First Nation on reserve communities that our organization looks after. The collaboration is great in my region, with our clinical lead being the provincial health authority. However, Indigenous populations face many barriers to TB elimination. Remote location of communities and advocating for adequate housing and access to nutritious food is something that I would continue to do, because it all affects the health and well-being of individuals, as well as continuing to bring awareness to social impacts that a TB diagnosis has on individuals, families, and communities. Involving both public and private sectors is needed, as every person's circumstances are different and may involve many different care providers or support throughout treatment. Also keeping in a discussion that TB also impacts one financially, as often people are required to isolate while beginning treatment, which means their time away from either school or their employment. Access to healthcare and services as well, pushing for up-to-date diagnostics in more of our communities to speed up diagnosis and treatment of TB, because we know that the best way to stop transmission of TB is to start people on treatment. And sometimes we can wait for days or up to a week for our medication to get to our community. So I'm kind of using, our commitments to advocate for us keeping treatment available in our communities so we can start people right away. And also pushing to promote inclusion of TB in the curricula of medical practitioner training, public health nursing, medical technology, nutrition, social work, and other related areas of training. So that's taken directly from the declaration. Pushing for mandatory training and education if your province or territory has TB, as there is always transiency and movement between the province or territory with these clients. So everybody really needs to be on the same page, or else we're never going to see TB elimination.
Excellent point, and such a fantastic perspective from someone who's working on the ground. I really appreciate that. Thank you for sharing. I'm going to just quickly ask you to segue to kind of open up in our next question, because you spoke so much about, the value of advocacy. But also you're reiterating, Canada's commitment to end TB by 2030 with a little bit of a reticent tone. And so I'd love to hear your thoughts on accountability, how to transition from advocacy in this work to holding leaders, holding each other to mechanisms for accountability. If you have recommendations either at your country or community level or at the high level. Oh, you're muted.
That has to happen at least once.
Oh, at least.
So I will use my role as a healthcare provider serving Indigenous and remote communities to advocate for what we experience at the community levels in regards to TB care. Our region is currently battling TB outbreaks. So I continue to advocate for TB related resources, tools, and services. I do that every single day. I actually, as well as a program lead, I don't typically do frontline work, but I have had to over the last couple months just because we don't have very much staff, but also visiting these communities, different communities, and really, going forward to their leadership, their band and council, and trying to inform them of, the TB situation in their communities, because that leadership at any form has to become take on some accountability and responsibility for their community. So really engaging in the TB program care delivery is really important for our leaders and for our program. And also reminding that in 2018, Canada committed as well to contributing, a fair share to TB research and development. Yet we have fallen short of that target every year since. The financial need for research and development has more than doubled since 2018 targets were set. Greater investments in research and development would transform the fight to end TB by enabling the development of new vaccines and more accessible diagnostics and shorter treatment regimens. So of course, making sure that these treatment options are available in our remote communities, for example, 3-HP or rifapentine for the treatment of latent TB infection, and having the ability to access that easier and making them more available. And also continuing to ask for the development of a national TB elimination strategy in Canada. So it has to be developed in collaboration with all the provinces and territories, Indigenous leaders, as well as TB affected communities.
Absolutely. Putting that advocacy, what we should be doing, into action, which is, concrete strategy, with mechanisms for accountability. If it doesn't get there. Thank you for your perspective, Tina. I'm going to go actually back to Juliana, who has worked in several countries around the world, and now kind of works with several all at the same time. And so Juliana, from a little bit more of a top of the trees perspective, where you're working with countries all over the world, I'd love to hear your thoughts on how the new declaration can advance TB programs in really diverse setting, across all countries, regions, cultures, languages. What are some of your perspectives there? And then if you could also speak to that transition from just advocacy, which is hugely important, to accountability. How can accountability mechanisms be integrated into all of this work?
No, thanks, Emily. I do think, and I don't know, maybe Monica said that or someone else, that the declaration really helps us push the agenda forward at country level. The question here is how? And for me, there is one component, which is the community-led monitoring, which I am very, very much interested in being more involved moving forward. And let me just take a step back, because I think that, yes, we have systems in country to monitor progress towards TB targets, okay? But these systems are normally handled by Minister of Health and, donor agencies and etc. And I feel these systems are sometimes not democratic enough, in the sense that they use a language that is sometimes very hard to understand and very hard to follow. And they keep, communities, outside. And community-led monitoring gives us an opportunity for communities actually to lead and really track what is going on at country level, so they can push the agenda and really use this as an accountability mechanism to say, this is not working and this is missing and this requires X, Y, and Z. I think that the Stop TB Partnership has one tool, that is one impact, that is the Stop TB Partnership's community-led monitoring digital platform. But what we really need here is communities to be leaders. And in a number of countries they are, but this needs to be like the status quo, and equal partners when decisions are made about service quality. And non-community members, as you said, like myself and somewhere else, I think we may or may not be just invited to provide support if they think this is needed or not. But for me, this is a big paradigm shift. And I think really the way that we, in some places, we see how data is being handled, it's really about decolonizing how we work with data. And that's really what I would like to see and propose as an accountability mechanism for countries moving forward. But another thing that and now I'm speaking for myself, I really want moving forward to have a more thorough engagement with organizations of people living with disabilities to let them know what's in the declaration and how we can actually help push the agenda forward. But that's
Thank you, Juliana. Yeah, you raised a point that actually hasn't been mentioned explicitly so far in this discussion, which is data, real data and information, and being able to, otherwise we're sort of just flying in the dark. Right, so excellent point. Thank you for that. And thank you also for highlighting populations that we maybe don't always think of, when we're thinking about access and equity of care. And so thank you for that. We're going to start wrapping up. We're going to ask if people can stay for a few more minutes. I want to hear from our last couple folks. With Aditya and Stella, what is one thing you're going to do after this forum to use the opportunity of the UN high-level meetings on TB to advance TB awareness, advocacy, and accountability? Stella, you're on video. Over to you.
Very sorry, I must apologize. I'm actually on transit. That's why my network is off and on.
Okay. Are you with us? Do you want me to repeat the question?
Yeah, please do. Yes.
Sure. So we're going to be wrapping up in just a couple more minutes. If folks can stay, you let us know one thing that you're going to do after this conversation today to use the opportunity of the UN high-level meetings on TB to advance awareness, advocacy, and accountability for TB programs.
Oh, all right, thank you. So you see that in the what happens is that to hold the government accountable, they must be carried along. They are actually the major stakeholders in this fight against TB. So they must be part and parcel of it. And they will have to do it in a way that they are ready to provide their counterpart funds that will help us fight this fight against TB. So we, on our own part, we try as much as we can to, a high level of advocacy that will help convince them that yes, what we are doing, we're not playing and we're not joking, because all of us are in this fight together. Anybody can get TB. It's not like HIV, where if you abstain, you will not get it. But TB is in the air. So the fight is for all of us. So we need the counterpart fund of the government to be able to fight this fight to its finish. Then, of course, for us, like I said earlier, we need to expand the services to private sites so that we'll be able to reach as many people as we can. But there are so many that don't even, they don't see them in health facilities. So many visit private, like all these patent medicine vendor stores, and that is where they are. So we need to strengthen that aspect of patents, where they can do the proper referral for us. So they need to be engaged more and more, so that we'll be able to fight these fights to help our people. Thank you.
Fantastic. Thank you so much, Stella. Thank you for your comments, your perspectives, your expertise, and your passion. Absolutely appreciated. Aditya, over to you. Tell us one thing you're going to do after today, coming up to the UN high-level meetings next week, to advance TB awareness, advocacy, and accountability, particularly where you work in Indonesia.
Okay, thank you, Emily. So I see this thing from two perspectives, I guess. First is from myself, and second is from my country. So first, as an individual, I'm also part of the Youth Indonesia TB movement, which has become the main platform for the young people and youth to share the knowledge and increase awareness related to the TB itself. So through this platform, we will share the result of this UNHLM on TB with all youth communities, people affected with TB, and also the community at large. And also, as I see from my country itself, we aim to, after the UNHLM meeting, we aim to engage more stakeholders partners, and also more sectors to take action on the TB control program, as well as engage to engage more private sectors. Even though we have engaged private sectors 3 times higher compared to 2021, but there is still a gap in the private providers who haven't been engaged with the national TB program, and also bring more other private companies and also industries together to hand in hand to combat TB. That's from my side. Thank you.
Fantastic. And any quick sort of closing remarks from you, Tina? One thing you're going to do after today to advance TB awareness, advocacy, and accountability as we head into the UN high-level meetings.
So I will continue to amplify awareness surrounding the HLM leading up to and following September 22nd, continuing to utilize opportunities to discuss the challenges and barriers to TB elimination in Canada, and focusing on addressing social determinants of health, for example, the dire need for adequate housing in our communities. As long as we have continue to have units that are, overcrowded and poorly ventilated or in needs of repairs, there will always be transmission among families and communities, and also fighting for adequate nutrition, access to clean drinking water and affordable food, because inadequate nutrition leaves community members vulnerable to illnesses. So those are just a couple of things that I'll continue to do.
Absolutely. And thank you for the reminder that when we're advocating around tuberculosis, we're not just talking about a disease. We're not just talking about a pathogen. It is all connected. So thank you for that. And I'll leave it with Juliana. Juliana, if you could wrap us up with just a few points, what are you going to do after this week as we go into the meetings on TB advocacy, awareness, accountability, and any final reflections on what our other speakers have shared today?
No, let me say that this was such a rich panel discussion. Tina, every time I hear you talk, it warms my heart because, it comes from the perspective of someone who is, at the front line working with communities. I think for me, my commitment in this leadership role that I currently hold is really to help elevate the voices of communities around the world in the countries where we work. I think it's very, very important that these voices are heard loud and clear, and that we get this message out there. I'm very tired of only hearing, top-down messages and, coming from elsewhere, of good God knows from where. So I think it needs to be reversed. I do feel that we have an opportunity with the 3 declarations at country level to try to integrate these key messages. These are not siloed conditions, TB, UHC, PPPR. This is actually very integrated, especially when we are talking about patients, communities, families. And I think this integration, unfortunately, wasn't seen in these final documents as much as we would hope, but we still have an opportunity at country level to bring these 3 agendas together and to make sure that, we integrate them and see results really at, communities that we serve. I think we're just gonna keep on working, and there's a lot to do, but I feel it's wonderful to be part of this community. So I thank you. Wonderful. And I see one hand up.
I do see that hand, and I'm curious if that's the comment. There's a comment in the chat to please ask the panelists to comment on the burden of drug-resistant TB and what needs to be done to strengthen the response. Is this Thilo? Thilo, is that your question? What you would like to ask?
Yes, Emily. It's a burning question for me. I'm in South Africa, and while we're seeing a declining incidence in drug-sensitive TB, I think our patients with drug-resistant TB and those who sometimes don't respond adequately to therapy don't have enough care and support. And I hear so much of South Africa's story in what Tina was saying about the First Nations in Canada. So I would like to find out what the panelists or what can be done to highlight the needs of patients with drug-resistant TB.
Great. Do we have time to get a quick response from our panelists there? Whoever wants to respond, go ahead. Thank you for the question.
I can say a quick comment. Although luckily, thankfully, we haven't had any drug-resistant TB diagnosed in my region since I've started working here in 2019. But I have experience, with isoniazid resistance or rifampin resistance, which, just means longer treatment with oral medication. But I think we'll have more trouble if we do get drug resistance and the need for, injections, and that will mean that our community members will have to be brought somewhere else for them to have adequate monitoring while they're on treatment. So that's always in the back of our minds, and we pray that that doesn't happen, that we don't experience drug resistance. But I'm sure there are drug resistant cases in other parts of Canada and other populations as well, but I can't speak to that.
Or do any of our panelists have a reflection on the imminent, unfortunately, challenge of drug resistance, multi-drug resistance, extremely drug resistant TB?
Well, we know that TB and drug resistance TB is among the leading cause of antimicrobial resistance in the world today. Oh, and that's where, Philo, I think there was a missed opportunity, because when we talk about PPPR and TB, that is exactly one point where I think these two agendas really come together very nicely, in the way that what are we actually doing, actively to prevent these cases. As you know, this is very complex when we talk about drug resistance TB, but if we are, achieving the targets, because the targets are for both, right, drug sensitive and drug resistance, and we are offering the type of diagnostic testing and follow-up and linkage and, social support systems, this would lead us, hopefully, to better outcomes. However, that being said, in South Africa, I think is leading the way on this, really having that component of community-led monitoring to ensure that we are keeping a very close look on what is happening with MDR TB. That is what I think we should be doing. But I agree with you. I had hoped for more, specific language around this topic. I think it's such an important one. And for me, it's like a silent tsunami, not so silent, right? That is going to hit us very hard in the near future.
Yeah, thanks for that. And we talk about this all the time, that the things that we can do to improve outcomes sort of in normal times and peace, or whatever that looks like, are the things that will prepare us for sort of the big complex challenges, whether they're pandemics of novel illnesses or waves of resistance or natural or man-made disasters. We know what to do. We just need the support.
And can I say one thing here, Emily? And that's where community systems lead the way, because really, I think, for patients that are undergoing treatment for TB, that support systems is so critical that we cannot emphasize enough. And anyway,
I think that is a fantastic way to close our discussion today. Thank you big time to all of the panelists for joining, whatever time zone you're in right now. Thank you for our participants for asking great questions, as well as to our facilitators for popping really relevant, really helpful resources in the chat. Petra, over to you to close us out. Thank you so much, everyone.
Well, this was really a very beautiful discussion, and I think has made everyone ready for next week. And honestly, next week is just a highlight where we will see TB in the spotlight, but all the issues that you've highlighted, including the excellent points in the chat from many of you, thank you for engaging. Thank you for all the panelists for bringing in such thoughtful and thorough comments. I appreciate all that you do on the ground, and that's where the real work, that's where it really, really matters. So thank you, Emily. Thank you, Juliana. Thank you, Monica and Robin, who really gave a kind of a high-level overview. But thanks to all the participants. And I'm really happy to share that there's also an article that we wrote today that is talking about the integration of the point that Juliana touched on. I'm going to pop it in the chat and I'll circulate it to people more widely. And it has a wonderful story of which I would love to share with you on the screen as our final kind of message. We created this story of a person suffering from TB and how the pandemic is relevant for people on the ground, and I would love for you to look at it. So if you click on the link, you'll find that story too, and this really illustrates with pop-up boxes why the TB declaration, the UHC declaration, and the PPR declaration are so relevant. So please feel free to use that tool next week as well, and if you enjoy it, give us some comments and feedback, and we try to kind of put materials out there that are useful for people as well. So with that, I would like to close today's session, and thanks and big hands up to everyone for all the work you do. Have a great rest of your Friday evening or your Friday. Shout out to everyone and hope to see you soon again. Thanks everyone. Thank you.
Thank you, Preta.
Thank you,
Shout out
everyone.
to you. Thank you.